Hi, good morning. My name is Kali Pu'ohao. I'm with the Hawaii Employer Union Health Benefits Trust Fund, more commonly referred to as the EUTF. With me behind the scenes is my coworker Marvin Judd, and we're happy to be here. We want to thank HSTA for sponsoring this presentation on your pre-retirement benefits, which is what I'll be going over with you folks today. So these benefits are specific towards your retirement as far as your health insurance benefits is what we're covering today. So without any further ado, let's go ahead and get right into the training here. Okay. Oh, hold on. Sorry, guys. Okay, here we go. I do also want to remind you folks that these sessions will be archived on Facebook as well as YouTube. So if you won't be able to stay for the entire session at this moment, you can always revert back. So welcome to our pre-retirement informational seminar, the same seminar that we offer live at least pre-COVID. This presentation is also available on an on-demand video at our website, eutf.hawaii.gov, but we are always appreciative to be able to present this presentation in this kind of format where we can actually take live questions as well. Which, by the way, if you do have any questions and if you are on Facebook or YouTube watching this, feel free to utilize the comment section, and we do have folks on standby ready to answer any questions that you may have. But let's go ahead and begin. So our agenda for today will be going over your pre-retirement, applying for your retirement health insurance benefits. We'll touch on eligibility as far as retirement plans. Then we're going to spend some time on Medicare. So Medicare plays a vital role in your health insurance, particularly for our retirees. So we'll spend some time there. We'll also go over premiums and contribution. This is the portion of the presentation that kind of helps explain how much you have to pay per month for your health insurance, if anything, depending on your years of service and whether or not you're vested, all that calculations, that's what this portion talks about. We'll go over your health plan options. What can you enroll in as a retiree? Completing the enrollment form, the EC2 form, required documents, making changes to your plans, and then at the end, we'll go ahead and take some questions. So new retirement enrollment. So when the time comes for you to retire, what you would first and foremost do is file for retirement with the Retiree Employee Retirement System, or ERS. Once you file retirement with ERS, they will furnish this letter for you. It's the ERS Retirement Estimate Letter. EUTF is going to need a copy of this letter because we're going to need to know what your final tally is for your years of service as well as your membership start date, or when you started working for the state. Okay, so again, this letter is furnished for you by the employee retirement system upon you filing for retirement. So you actually have to file for retirement in order to get this letter and start the process. So it's the first thing we need to sign you up for your health insurance coverage as a retiree. Eligibility. So those eligible for the EUTF retiree plans, of course, are retired employees. Some things to remember: you do not need to be covered under active EUTF plans at the time of retirement in order to be eligible to enroll in EUTF retiree plans. So what does that mean? We actually have a lot of state employees, teachers. They don't have their active coverage through the EUTF. They actually have coverage maybe through a spouse or some other way of getting their health insurance, and that's fine. So when the time comes for them to retire, they always ask this question: wait, do I have to sign up while I'm still working to qualify for my health coverage when I retire? And the answer to that question is no. You do not need active coverage as a prerequisite or in order to retire, file for health coverage when you retire. The act of you retiring actually qualifies you for our retirement benefits. Okay, so no active coverage needed. Also, if you retire for the state or the counties, you already left as a retiree, and you decide you want to come back, you want to start working again for the state or the counties, maybe you want to go back teaching, what have you, please notify the EUTF as a retiree. You need to let us know. It may affect some of your benefits. We need to have that conversation with you. In some cases, no. In some cases, yes. Uh, Better to be safe. Contact us if you retire and then later decide to go back to work for the state or the counties. Now, if you go back to work, private sector, you start, you work for Starbucks, that's fine. You don't need to contact us. It's mainly if you go back to work for either the state of Hawaii or the counties. Okay, also eligible is the retiree spouse or partner, and by partner we mean domestic or civil union, as well as the children of the retiree spouse or the retiree's partner. And these are children by either birth, adoption, legal guardianship, or foster child. Some important information regarding dependent limits on their age. Uh, for the retiree plans, children are covered to age 19 for medical, prescription drug, dental, and vision plans. Please notice that's very different from the active plans. Active employees can cover their dependents up to age 26 for medical and prescription drugs. That's not how the retiree plan works. Retiree plans cover dependents from medical prescription drugs to age 19. However, if they are full-time students, they can stay on plans until age 24. The reason why there's that difference is because group sponsored plans or health plans that you maintain because of work were affected by that 2010 uh, age change for dependents. Back in 2010, the federal government came out with rules where employer groups needed to cover dependents up to age 26 for medical and prescription drug. That's why the active plan's that way. That same federal rule, though, didn't apply to retired plans, which is what this is. That's why with the retired plans, the age limits never changed. It was always up until age 19, unless they're full-time students, then they can go up to age 24. Okay, so please keep that in mind, because if you're planning on retiring and you have dependents around that age, your retirement actually may cause them to lose their health coverage, right? So something that you need to know. Also, legal guardianship or foster children will terminate upon the age of 18, regardless of whether they are full-time students or not. And that holds true for both our active as well as our retiree plans. Coverage can continue until Coverage can continue for an unmarried child incapable of self-support due to a mental or physical incapacity that existed prior to the age of 19. So disabled children can remain on plans past age 19. So what happens? We get this question a lot. If the retiree passes away, how does that work if they are still covering dependents on the retiree plan? So eligibility does extend to a surviving spouse, domestic or civil union partner of a deceased retired employee, provided that the spouse or partner does not remarry or enter into a new domestic or civil union partnership. Also, an unmarried child of a deceased retired employee can also remain on plans, provided that the child is under the age of 19, or in the case of a full-time student, 24, and the child has no surviving parents. They can remain on the retiree's health coverage if they pass away. Dual enrollment. So EUTF rules specify that both you and your spouse or partner are employees and or retirees of the state or the counties. You can enroll only in one family plan or a two-party plan, or if it's just the two of you, you can do self plans for yourselves. Okay, so basically what you cannot do is, if you have a family, if both you and your spousal partner are either working for or retired from the state, you both cannot sign up on family plans and then cover each other with two EUTF plans, what we call dual enrollment. So not allowed under our rules. Children cannot be enrolled by more than one employee or retiree beneficiary at any given time. Okay, so that's when there's two EUTF plans involved. All right, now dual enrollment is perfectly fine if you have EUTF coverage and your spousal partner is covered by something outside of EUTS, like they're a federal employee or a federal retiree, or they work for, you know, private sector like the bank, and you can have double coverage that way. So this definition of dual enrollment is specifically addressed the enrollment of two EUTF plans, which is not allowed. Okay. Okay, so now we're moving on to Medicare. So before we begin Medicare, things can get kind of complicated with Medicare. Some things to remember: it is a federal program, and we're not covering all the aspects of Medicare in this presentation. Only how it relates to retiring with the EUTF and enrolling into your retiree plans. But there is a lot to Medicare. It's part of the Social Security. For most Americans, you qualify when you turn 65, and there's a lot of other little things about Medicare that, you know, we all as beneficiaries should know. As far as being under Social Security. So we're not going to cover everything. You probably will have questions. We highly recommend you contact Medicare Direct, or in enrollment, as far as we're enrolling in Medicare, you want to contact Social Security. Okay, but here we go. We're going to talk about Medicare as it relates to EUTF. All right, so right there at the top, mandatory Medicare enrollment. Okay, so retirees eligible for Medicare Part B must enroll in Medicare Part B when they become eligible in order to be enrolled in EUTF retiree medical and prescription drug plans. Okay, very important. Covered dependents eligible for Medicare Part B must also enroll in Medicare Part B when they become eligible. That's regardless whether they are retired or actively employed, if enrolled in EUTF medical and prescription drug plans. All right, so you must provide the EUTF with proof of your Medicare Part B enrollment within 60 days of becoming eligible or enrolling into an EUTF retiree medical and or prescription drug plan. Please submit a copy of your or your dependent's Medicare ID card. All right. Now, I do want to point out this mandatory Medicare enrollment into Part B is for retirees. If you are still working, if you're still a teacher and you're past age 65, uh, whether you or the age 65 is coming up and Medicare enrollment is looming, and you're wondering, hey, do I need to enroll into Medicare? That's up to you. The choice is yours. Contact Social Security and see how that would affect your health coverage and some other things, whether you want to enroll in Medicare or not. But the mandatory Medicare enrollment is when you are no longer working. If you're no longer working, in order to retire and enroll into EUTF medical and prescription drug coverage, you have to be on Part B if you are eligible. So eligibility, of course, for most Americans, it's age 65 or older. Okay, so we'll continue on this tracking on along this, and hopefully it'll become a bit more clear as far as Medicare's role with EUTF. So how do I roll into the Medicare Part B program? You contact Social Security. So the Medicare program is a branch or an arm of Social Security. You would contact them, okay, about enrolling into Medicare, preferably 3 months prior to your 65th birthday, providing that you're retired at that time, okay, or your retirement date if you're going to retire past age 65. That's when you want to contact Social Security about enrolling into Medicare 3 months prior. If you are already retired, EUTF will send a courtesy letter to retirees and their spousal partner to enroll into Medicare Part B. If you are receiving Social Security benefits, which normally occurs around age 62 for most Americans, but if you are receiving Social Security benefits at that time, you will automatically be enrolled into the Medicare Part B upon turning age 65. All right. Now, failure to provide proof of Medicare Part B enrollment will result in you and your dependents' disenrollment from EUTF medical and prescription drug plans. Okay, so again, very important that at the time of retirement, whether when you enroll or if you're already retired and you turn 65, you need to have Medicare Part B in order to maintain your medical and prescription drugs, or to enroll into your medical and prescription drugs. Okay. Now, you may be able to suspend your Medicare enrollment if you have credible group sponsor coverage while employed. Okay. Again, contact Social Security for more information. This next slide shows the federal Medicare Part B premium rates for 2021, okay, as of January. All right, so why are we showing this? Uh, it's going to come apparent in a little bit. So if you look at that first line on the right corner at the top of the chart, the dollar amount, $148.50. That is the standard Medicare Part B premium that Medicare beneficiaries across the United States pay a month for their Medicare Part B. So Part B Medicare is not free. You have to pay for Part B Medicare, okay? And it's the part of the Medicare that covers your outpatient services, your doctor visits, laboratory services, x-ray, ambulance, all that falls under Medicare Part B. It has a monthly cost. The monthly cost changes uh, every year. All right. And uh, in most cases, it changes every year. So for this year, that's the monthly cost, $148.50. Now you will notice that depending on the amount that you filed in taxes, some Americans pay more than that 148.50. And what Social Security does is they do what's called a 2-year look back. So for this year, they're looking at the income tax you filed in 2019, 2 years ago, and it's they look at the gross. Okay, so for if you look at the chart here, for those individuals that filed uh, they filed it as an individual, $88,000 or less ended up being their gross for 2019. They fall into that standard. Of course, if they filed joint, then it's 176 or less. 176,000. But you can see on the chart as it progresses more, the monthly Part B also goes up. So at the end of the spectrum, if they're at half a million filing as an individual or a quarter of a million, their monthly Part B premium is 509 504.90. Okay, so why are we showing you this? We're showing you this because as part of your retirement benefits, the state will actually reimburse your Medicare Part B for retirees only. Okay, so for retirees, we will reimburse your Medicare Part B. The amount that we reimburse is based on that 2-year look back for a given year. It's based on that 2-year look back, right? Wherever you fall into that category. Okay, so because it's a retirement benefit offered through the EUTF, in addition to covering you for your medical, your HMSA, your Kaiser, your dental, your vision, your prescription drug plan, all that, this is another component of your retiree benefits. We're going to also cover your monthly Medicare Part B premiums. All right, not just for you, but also for your eligible spouse as well as your partner or partner who also have Medicare. All right, so what we need our retirees to do. So if you retire, you sign up for EUTF plans for you and maybe your spouse, and you are eligible for Medicare. We need you to submit to us something in writing, letting us know how much are you being billed for your Medicare Part B premium. Okay, so that we can reimburse you. So in most cases, most retirees use that Social Security Administration letter. But we'll take that, or we'll take a billing invoice or something that indicates that comes from Social Security, indicates your Part B premium amount that you pay every month, and has your contact information, your Medicare ID number, and all that. So that's what this line is showing. Okay, so Medicare retirees and or dependents that pay higher income related monthly costs. So if your amount that you pay actually wasn't the standard, the 144.50, but you pay above that standard, in addition to submitting to us the letter when you first enroll, we also need a letter every year, preferably around the month of January, to let us know how much do we reimburse you. Because once you retire and you are on the EUTF system, when your Medicare Part B reimbursements are sent to you, the reimbursements that we forward to our retirees are based on the standard. So they automatically get that 148.50 or whatever the standard is. But if you're one of those where you did your 2-year look back and your taxes ended up going in the higher brackets, you need to let us know so that we can adjust the amount accordingly and give you the higher reimbursement or whatever the actual reimbursement is for you. Okay, so if every year you file your taxes and you end up in that higher bracket area, then every year we're going to need that social security letter or something, some kind of invoice from social security, so that we can adjust your reimbursements accordingly, just to make sure that you are getting all the monies that's due you based on this reimbursement benefit for your Part B premiums. Okay. Now, in addition to the letter from social security, so we know how much how much to reimburse you, we also need you to fill out this direct deposit agreement form. Okay, what this form allows us to do is to direct deposit your reimbursement straight into the retiree's checking or savings account. Okay, so you don't have to deal with getting a paper check. So when you initially sign up for your benefits with the EUTF and you become Medicare eligible, we're going to have you complete this direct deposit agreement form, and to set all that up so that you can start getting your reimbursements from us. Okay. Now reimbursements are done on a quarterly basis. All right. Medicare will bill you monthly. You'll get reimbursed by us quarterly. Okay. And reimbursement either begins the latter of the effective date of Medicare Part B coverage or your retirement date. All right. If you had already been on the in the system, or the first day of the month, EUTS receives a copy of your Medicare Part B card, Social Security Administration letter, and this direct deposit agreement form. So we need all three documents when you retire and you become Medicare eligible. All right. Uh, Complete the direct deposit agreement form for if you're going to use a checking account, we also need a voided check. If you're going to use just a regular savings account, you do need to walk this form into the your financial institution, and there's a portion section there where the bank needs to sign. Medicare Part D. So Medicare requires that you're enrolled in only one Medicare Part D or Medicare Advantage plan. If in the future you enroll in a non-EUTF Medicare Advantage or Medicare Part D plan, you may be disenrolled from EUTF's Kaiser Senior Advantage Plan, Humana's Medicare Advantage Plan, or the SilverScript Medicare Part D prescription drug plan. So please remember that. It's not so much of a problem nowadays, but maybe a few years ago, we had a lot of retirees enrolling in Medicare Advantage plans. What that was doing was kicking them out of their medical and prescription drug benefits, which is of course not a good thing to lose your EUTF coverage because of that. So please be mindful of that. And just to reiterate, your EUTF medical plan options include the Medicare Part D prescription drug plan administered through CVS. So if when you retire and you sign up for EUTF retiree benefits, if you decide to go the HMSA, CVS and SilverScript will be your prescription drug coverage. Okay. And of course, there's Kaiser available to our retirees as well. So EUTF Kaiser Permanente Senior Advantage Plan. That's Kaiser plans for Kaiser members that become Medicare eligible. We also have a new Humana Medicare Advantage plan that began the big first of the month this year, and then the default HMSA plan is a 9010 PPO. Okay. And one last thing, we do reimburse your premiums for the medical part B. If for some reason your higher income level results in additional premiums for the prescription drug side, we don't reimburse that. It's only for the medical that we reimburse. That one would be just paid directly to Medicare by the retiree. Last slide for Medicare. If you enroll in HMSA and you get the CVS Caremark, or if you decide to just enroll into the CVS Caremark just by itself, that's fine. But do understand, once you become Medicare eligible, you're going to have your prescription drug card is going to switch over from regular CVS over to the SilverScript Medicare Part D. Now, it does take some time for the Part D enrollment to process on Medicare's end. So in the meantime, it can take as long as 45 days. In the meantime, EUTF will send you a comparable CVS Caremark card. You can use that card until your SilverScript card comes into the mail. And then at that time, go ahead and use a SilverScript card and just disregard or just throw away the CVS card. So this slide is really, we were having a lot of questions. Our retirees that became Medicare eligible and went on a CVS SilverScript plan, Medicare was taking a while to okay their enrollments. So in the meantime, they would get this SilverScript. I'm sorry, they would get the CVS card, to use in the interim, and there's some confusion. Hey, I was supposed to be on the SilverScript. What's this card? So that's why you get CVS Caremark card until Medicare is done processing your enrollment, and then the Silver Script card will be mailed to you. Okay. Premiums and contributions. So this one, as I mentioned, involves your employer contribution, or what the state pays towards your retiree premiums on a monthly basis. So as an active employee, the portions of health coverage costs paid by the employer are negotiated through collective bargaining. We're actually going to go through one this year. Okay, so that's how premiums are calculated while you're employed. But once you retire, it's a little different story. So as a retired employee beneficiary, the portion of health coverage costs paid by the employer is determined by law. Okay, how does that work? That's what we're looking at this time right now in this section over here. Okay, so on your screen is the 2021 base monthly contribution, or what we call in the office here the BMC. All right, the BMC is broken into two categories. Either the retiree has does not yet qualify for Medicare, the non-Medicare maximum allowable, or they have Medicare. Single two-party family. Okay, so for example, a non-Medicare retiree, so they're not 65 yet, they don't have Medicare, and they're covering themselves and a spouse or partner, or maybe a dependent child. The most contributions that will come from the state per month for that particular retiree is $2,101 for 2021. Next year it'll be something different. Last year the funds were so it these amounts change every year. If they're Medicare for family, okay, it's 2,164. So these base monthly contributions are adjusted every if they are adjusted, it'll be January 1st, the beginning of the year. And what drives these numbers, what makes these numbers go up and down, or go up, they almost never go down, is whatever the going Medicare Part B premium is for that year. So increases and decreases towards the Medicare Part B premium. All right. So we're gonna keep tracking along this section here. A lot of it may not make sense, but I guarantee you it will make sense at the end. So at this point, just know that there are set dollar amounts per month for our retirees, and a chart that is used by the state in order to calculate or to yeah, to calculate the contributions that the state will pay towards our retiree health plan benefits. Okay, they're set in stone depending on Medicare or non-Medicare, whether the retiree has a single plan, two-party plan, and family plan, set in stone for that year, for 2001. Okay, and adjustments are made in the beginning of the year, and these numbers are driven by Medicare Part B. Okay, so how does this thing work? Employer contribution. The employer premium contribution is determined by statutes, and it is based on three factors: the employee's ERS membership date, or when you started working for the state. When did you start becoming a teacher? Right? That's your membership date. The length of service. How long have you been working? All right. That's your years of service. 29 years, 9 months, 15 years, 7 months, whatever the tally is, or the final tally when it's time for you to retire, and whatever the base monthly contribution is. So membership date plus length of service goes into calculating base monthly contribution for our retirees. So this next chart is our employer contribution chart. Okay, the top axis across the top is your membership start date axis. So when did you start working for the state? All right, and then the axis on the side is your years of credited service. Okay, this excludes sick leave. All right, so what you can do if you're watching this is you can go ahead and try and find yourself on the chart now. All right, so figure out when you started working. All right, like I'll give you I'll use myself as an example. So I started working for the state uh, April of 2014. All right, so I have less than 10 years. So I'm a zero if you guys see that. But look, how long will it take me to get to the 100%? 25 years. Okay, but at the 15-year mark, I'm at 75%. Okay, so I'm at the far right end of the chart there. Okay, so that's how you use this chart. Now, keep in mind, If your membership start date is on or after July 1st, 2001, which mine's happens to be, the monthly employer sponsored contribution will be calculated on the base monthly contribution for self only. You may obtain coverage for eligible dependents, but you will be responsible for the difference in premium costs. Okay, very important. That's that double asterisk mark there. So, what does that mean? This is what that means. So, the next slide here, you see the top table, that's for membership start dates that began before July 1st, 2001. They have Medicare, non-Medicare for single, two-party, and family. If your membership start date occurred on or after 2001, your contributions from the state only go to you. So you can enroll your spouse or dependents as a retiree. However, the cost of enrolling your spouse or dependent will come out of your pocket. So after July 1st, 2001, state of Hawaii no longer contributes towards dependents, whether it's a spouse or dependent child. Prior to, they will. After July 1st, it's for the retiree only. Okay. So the percentages as shown previous, if you ended up being at that 100%, what happens is you actually have access for the entire amount. Okay, the whole $1,042 in my case, if I hit 100%. Okay, uh, what results of that is you will probably pay nothing for your health insurance. That's why 100%ers in almost all cases don't pay anything when they retire, and they're 100% for their premiums per month. Okay. If you fall into the 50 or 75% category, you would complete the retiree premium worksheet available on our website, and it'll help calculate what your monthly cost will be depending on the selections that you choose for your retirement plans. And of course, if you ended up with zero contributions, no contributions by the state, you can still enroll in plans. You just pay whatever the going rate is for your health insurance. Okay, still confused? This will help. Okay, here's an example. This example will help bring everything together. So in our example, we have Malia. She will be retiring at the end of this year, December 1st. Does not qualify for Medicare yet. Okay, so she's under age 65. She so we will look at the non-Medicare base monthly contribution amount for single. So this is just for her. So potentially the most she could get is $1,042 for this year, 2021. All right. Now we get our ERS retirement estimate letter. Okay, and it shows that her membership start date was July 1st, 99, and she has 22 years total earned years of service. Okay, so if you revert back to the previous chart, that will put her into the 75% category. Okay, so she'll get 75% of the total base monthly contribution of 1042, which ends up being $782. Now, her selections for her medical plan, she wants the HMSA 9010 plan at $597 a month, the CVS prescription drug plan 216, dental's $43, $5 for the vision coverage, and the life insurance is 100% paid by the employer. So her total monthly cost in premiums for her plan selections is $862. Okay, so at this point, all it is a matter of subtracting the base monthly contribution at that 75% level minus the amount, the cost of her health plan selection. So in Malia's case, her total ends up being $80 that she'll pay for per month for the year 2021. Come 2022, new base monthly contribution amount comes out, new premiums come out for the medical, prescription drug plan, dental, and vision, and you recalculate the whole thing and you start all over again. That's at the 75% level. Okay. That's how this works. And, when the time does come for you to retire, we do have worksheets that you can use in order to help you calculate what that month is. Now, you notice she has 22 years of service. If she had worked 3 more years, she would have been in that 25-year category, which would have gave her access to 100% or the whole $1,042, which would have, totally engulfed that $862, right? That's why 100%ers don't pay premiums, because the state contribution amount Okay, we have that thing set to where if you hit that 100%, that full contribution, it ends up washing out the health plan selections. All right. So that's how this whole process works. Um, Now we do want to stress that it's the system works fine. It's been working fine for many years. However, you cannot predict what the market's going to look like as far as the healthcare landscape. So HMSA 9010 plan is 597 per month for an individual. Now, who's to say how high that amount will be 10, 15 years down the road? If at any time the actual premium cost that 862 ever exceeds whatever we have set for the base monthly contribution, the retiree will be responsible for the difference, is how this thing is currently set up. Okay. Now, again, we've taken measures to have this thing set up based on the Medicare Part B premium to where that's probably not going to happen anytime soon, if ever. But the possibility is always there. All right. So we really want to educate you folks and to let you know how this process works and what the possible scenarios could be. All right. As far as what your monthly premium cost will be. If you are paying if you when you retire, if you're paying per month for your health insurance, you have to pay a monthly premium. There's different ways that you can actually pay that premium. One is through credit card or electronic check, which is actually no longer utilized as much, but it is available. The more popular would be deductions from your bank account via ACH payments, or this new one that went live about 2 years ago. We can now have the amounts direct deposited straight out of your your pensions. It just be a pension deduction. So there's a form that retirees would fill out for that. So those are ways. And of course, if you're a 100%er, this isn't something that you would need to worry about. Your health plan options. So your medical options, there's one HMSA plan, 9010 PPO plan. Okay. So retirees do not have access to, four different HMSA plans like they did when they were working. So it's one HMSA plan. We did pick the high end of the four, though. It's the 9010. There's a Humana Medicare Advantage plan also available. That's a new plan that just came on board, as well as Kaiser HMO medical with prescription drugs that turns into the Kaiser Senior Advantage plan when they become Medicare eligible. Prescription drug coverage for HMSA members, it's CVS Caremark or SilverScript once you become Medicare eligible. That's also the standalone option if you just want drug coverage with no medical. And then Kaiser, of course, Kaiser members have their own prescription drug plan. Dentists with Hawaii Dental Services, Vision is with VSP, just like active plans, and then Securance Financial for the life insurance. So for your HMSA plan, it's the 90-10 plan. So your out of pocket is the 10% of the whatever the remaining balance is up until you become Medicare eligible. And then something happens. You get something called dual coverage. Medicare pays first, the 90-10 plan picks up the difference. As long as all the deductibles are satisfied, in most cases, the retiree, it's their services are covered at 100%. All they pay is maybe tax if they charge tax. So it's kind of a great deal for those under the 90-10 plan. For Humana, it works a little bit different. It is a 90-10 type plan, but there's no 1-2 punch when you become Medicare eligible. Your Humana plan is your Medicare plan in a sense. So there's no coordination of benefits between the original Medicare. Still a great plan though. What's good for the type of retiree that would probably like the Humana plan is maybe one that may not have gotten the 100% or maybe even the 75% because it's a very low costing plan. And Humana's um, provider access on the mainland outside the state of Hawaii is great. So if you plan on relocating uh, to the mainland, this and HMSA does have the Blue Cross Blue Shield, but the Humana network is a little bigger. So this is something you may want to look into if you fall into that category. So we try and offer health plans for our retirees that may experience different scenarios. Kaiser, of course, is also available for our retirees, and we have used the Kaiser. This plan is similar to the Kaiser Comprehensive. If you're a Kaiser member, you'll know which plan I'm talking about. So great plans. Um, it's an HMO, $15 for your doctor visits, and 100% coverage for your big ticket items, hospitalization, surgery. It's a great plan as well. Certain areas in the states not available. In those cases, you just default to the regular Kaiser plan. And when I say not available, I mean the Kaiser Senior Advantage, the Medicare Advantage for Kaiser is not available, but Kaiser members can still default to their regular Kaiser. Prescription drug coverage under CVS and Kaiser. You see a lot of numbers here. Really, the takeaway from this slide is once you retire, the amount you pay as far as your out-of-pocket co-pays go down, and when you become Medicare eligible, they go down even more. So it's a great deal when you retire, especially for on the prescription drug side. Some other plans. So there's no chiropractic coverage for eutf retiree plan options. Okay, so keep that in mind. Your dental plan is almost identical to the active plan with one exception. Other services is normally covered under 80% for active employees. When you retire, that drops down to 60%. Vision under VSP, the plan is exactly the same. And your life insurance, that's employee paid for retirees, the death benefit is $1,815. Okay, and just to make the comparison between the active and the retiree benefits. So limiting age for your dependents, again, as I mentioned earlier, for active plans, you can cover dependents for medical and prescription drugs to age 26. Not so with the retiree plan. It's age 19, unless they're full-time students, then they can go to age 24. Prescription drug coverage, your co-payments are a bit lower once you retire. Again, no chiropractic benefits. Dental benefits for active plans. You do have that 80% coverage for other services, also limited orthodontia services. For retiree plans, that 80% goes on to 60 with no orthodontia services. That's the other thing about the retiree dental plans. Other than that, it's exactly the same. And Medicare Part B. So if you're still actively employed, hey, should I sign up for Medicare Part B? Do I need to? It's up to you. There's no requirement while you're still working. Okay, the requirement hits you when you retire. Okay, so eligible retirees and dependents, including disabled children, are required to enroll in Medicare Part B for coverage under retiree medical and prescription drug plans. So if you want to enroll in medical and prescription drug plans through the EUTF, your HMSA, your Kaiser, and you are eligible for Medicare Part B, you must enroll in Medicare Part B, or we cannot sign you up for HMSA and Kaiser plans once you become eligible for Medicare. So the enrollment process, you need to complete the EC2 form, and here's what the form looks like. Very similar to the EC1 form. At the top, mark retirement and include your retirement date and then your contact information under the retiree data section. Under coverage start date, leave that blank. That's not used for retirement. And under the plan selection, select which plan you would like to enroll in and your coverage type, self, two-party, or family. Flip the form over, put your name on the upper right-hand corner, and if you're covering dependents, we would also need you to indicate that at the line items provided in that table there, with name, date of birth, social security numbers, and which plans you want them under. If we don't already have it, we also need proof documents, marriage certificate or your domestic partner or silver union documentation, birth certificates for any dependents, and student certification if your dependents over the age of 19, but you want to keep them on plans and they're full-time students. Okay, if we have this information, you're coming off of active plans, you already sent this to us prior, then that's fine. Okay, so for Medicare, please complete this section, your name and your Medicare claim ID number if you are a Medicare beneficiary. If not, leave it blank. Other insurance information, if you do have other health insurance, maybe your spouse is working or retired federal or retired from private sector, we like to know about it. If you can complete that section also. If it doesn't apply, again, leave it blank. And then finally, sign and date the form, and you must submit this form within 60 days of your retirement in order for us to process your enrollment. okay, along with any proof documents. Once we process your retiree health plan enrollment, you will get a confirmation notice in the mail. Please check it. Make sure we spelled everyone's name correctly. Make sure we enrolled you into the correct plans. If everything's good to go, then keep it for your records. If there are any errors, then use the corrective action form in the confirmation notice. All changes need to be in writing, is why you would do that. Um, and then mail that form in with whatever corrections are needed, and we'll go ahead and take care of it. Okay. So just to sum up, required documents. Time comes for you to retire, and you need to enroll in eutf health insurance plans for retirees. First thing you would do is, of course, file for retirement with the Employee Retirement System, or ERS. Uh, During that process, ERS will send you their retirement estimate letter. Once you get that letter, that's when you can start the process with EUTF with us. Okay, so we're going to need that. Fill out the enrollment form and let us know who you are, what plans you want, when are you retiring, and who do you want covered under your plan. Okay, 60 days is it must be received within 60 days from the retirement date, either 60 days before or 60 days after, but within that 60-day window, 120 if that helps. Okay. Now, um, if you are retiring and there is no Medicare involved, you're not 65 yet, that's pretty much all you need to do. Okay. But if there's Medicare involved, then we need, of course, a copy of their Medicare card, all right, showing Part B enrollment, direct deposit agreement form, so we know what financial institution to deposit your reimbursement for your Medicare Part B, and then that letter from Social Security or some invoice letting us know how much is your Medicare Part B premium, like what's the amount we need to reimburse. So send us that as well. Those are those three Medicare documents that you would need to submit over to us. If you are paying for your monthly premiums, you're like a 75%er or less, and you do want it deducted, then you would definitely need to submit to us this form as well. Okay, the ACH pension deduction form. Okay, so this next letter document will not come from you, but we do need end of employment or termination notification from your employer. Okay, now for DOE, uh, for teachers especially, you need to notify your administration or your principal. Okay, that will trigger this document to get sent over to us. Okay, very important, which of course you will, but that's how we get this. This is important because this document will notify us to cancel your active plans, and we need to do that before we can sign you up for your retiree benefits, because you cannot have the two going at the same time. Active has to cancel before we can activate your retiree plans. That's why this document is important. So again, notify your administration or principal when the time does come for you to retire, so they can get this document over to us. Cobra. Cobra will be sent to retirees previously on EUTF active plans. Okay. Now, we always get a lot of phone calls for Cobra because retirees will call us and go, "Hey, I already enrolled in my retiree benefits. Why are you sending me Cobra? I don't want Cobra. Cobra's too expensive." Okay, we have to send you the Cobra regardless, because it's a federal mandate. That's why we're sending you the Cobra. Okay, so federal government told us to do this, do it. That's why we're doing it. So that's why you're getting the Cobra. All right, and go ahead and read it. It's got some good information in it. Making changes to your plan. So we're winding down. Qualifying events. So let's say you're retired and you signed up for your ETF coverage without a hitch and everything's going fine. And then you run into a life event. You end up getting married or divorced, or you experience some kind of loss of coverage, or you move out of the service area. This is for Kaiser members. Let's say you're living in an area where they had Kaiser, and for some reason you had to relocate to an area without any Kaiser. That's a qualifying life event. Okay, so if you experience one of these as a retiree, don't panic. All you need to do is go to our website and download that same enrollment form, EC2 form, fill that form out, let us know what the event is, and we can go ahead and make any kind of adjustments on our end. For example, if you get married on February 14th, go ahead, download the form, fill it out, and submit your EC2 form, signing your new spouse up or partner up onto your eutf retiree plans. Now you have 45 days to submit this information over to us. That includes any proof documents. So in the case of marriage, we're also going to need a copy of the marriage certificate. All right. Um, so what you would do is you would need to submit that form within 45 days of the event date. So that would be, in my example, February 14th. You got 45 days from February 14th to send us that document. Okay. Now, some folks experience delays, particularly in marriage. They experience delays in getting that marriage certificate. If that 45-day time limit is coming, this goes for any one of the qualifying events. If it's about ready to hit and you don't have the document, give our office a call if there's going to be some delays, and we can, we'll work with you as so long as you call us before the 45-day time limit. Okay, if you call us after that, then you're gonna have to wait till next open enrollment to enroll your spouse in that case. Okay, so everything is 45 days. Retirement, we actually give you 60 days, as I mentioned earlier in the previous section. Or bless your heart, if you have a newborn child as a retiree, we actually give you 180 days to sign up your newborn baby to your retiree plan. Okay. As I mentioned, proof documents, you have 45 days to submit that information over to us. And wrapping it up, open enrollment. So retirees also have their own open enrollment. It normally occurs within the month of October. During open enrollment, retirees have the ability to make changes to their retiree benefits. They can either add, remove, or change plans. They can add or remove dependents. The new coverages or any kind of premium changes take effect January 1st. So when you retire, your plan year will actually model the Medicare plan year, January 1st to December 31st. It's not going to be July 1 like it currently is for our active employees. Okay. And we're pretty much done with our presentation. Keep in mind that this entire presentation, including the slides, are available as an on-demand video on our website under the Learning Center. If you wanted to do a deep dive into some of the concepts I went over, like that Medicare reimbursement or the premium and contribution part with the tables and all that, that's all contained in our 120-page retiree reference guide that is available as a PDF on our website, eutf.hawaii.gov. And that is all I have for our presentation. Thank you so much for attending. At this time, are there any questions, maybe in the chat room? And again, as we mentioned, this entire presentation will be archived on Facebook as well as YouTube. And we also have some other resource items on our website. There's a pre-retirement checklist. It's a 4-page summary of pretty much everything I went over, as well as Medicare. There's a separate Medicare checklist as well that goes over some of the Medicare enrollment periods that affect our retirees. But at this time, if you folks have any questions.
Are pretty good, Kali. I think you answered most of them.
Okay. Okay, well, if we have no questions, we're gonna go ahead and close this session. And like, past sessions on Facebook and YouTube, a lot of folks won't probably view this until much later in the day, or maybe 2, 3, 4 days later. If you have questions, go ahead and respond in the comment section, and we actually will periodically monitor the comment sections in the next couple of days, and we may be able to get to that question as well. But thank you again, HSTA, for inviting us, and thank you so much for your time and attention this morning. Take care.